In Orange County, Latino residents are getting vaccinated against COVID-19 at much lower rates than their white counterparts, prompting experts and advocates to call for a more equitable rollout. Just over 3% of Latinos in the county have received at least one dose of the vaccine, compared with 10% of white residents, according to county statistics. About 6% of the county's Asian Americans and Pacific Islanders and less than 1% of the Black population has been at least partially vaccinated. Similar disparities in vaccination rates exist statewide and in neighboring Los Angeles County. People are being left out and left behind, said Santa Ana Mayor Vicente Sarmiento. The way I see it, relief delayed is relief denied. The low vaccination rates among Latino residents can be attributed to the difficulties of making and traveling to appointments, in addition to suspicion of the vaccine among some people, said officials and advocates for communities hard hit by the pandemic. The state's universal eligibility for those 65 and older also creates an imbalance, since those in Black and Latino communities skew younger. The disparities are continuing despite efforts to reach underserved areas through clinics set up at schools and senior centers. The state this month shifted 40% of its available vaccine supply to underserved areas, including Santa Ana. But elected officials and experts say inequities in the vaccine rollout set Latinos behind from the beginning, and data shows they've been struggling to catch up ever since. As COVID-19 took hold across California, communities of color were especially devastated. More Latinos become infected with the coronavirus, they were hospitalized more and they died at higher rates than any other ethnic group, according to state data. Bernadette Boden-Albala, a member of the OC Healthcare Agency's Vaccine Task Force, said the data should have made it clear to officials early on that vaccinations must reach Latinos and other communities of color first. The findings provide evidence of deeply rooted health inequities that exist even in affluent counties, said Boden-Albala, a professor of public health and the founding dean of the program in public health at UC Irvine. COVID-19 is the disease of disparity, she said. If anything, what we've learned from this horrible epidemic is there's got to be a paradigm shift in public health. What it stands for and how to approach it so we don't have health equity issues again. Latino residents make up 34% of Orange County's population but only 14% of the people who got at least one shot between December 15 and March 15, county statistics show. Whites are overrepresented at 40% of the population and 44% of those with at least one shot. Asian Americans and Pacific Islanders are also slightly overrepresented at 22% of the population and 24% of the vaccinated. Black residents are 2% of the population and 1% of the vaccinated.